Hi, my name is Dr. Umair Shah. I'm the Executive Director and Local Health Authority for Harris County Public Health. Harris County Public Health is the county health department for the third largest county in the United States. We have over 4.7 million people, and we're geographically spread over a size larger than the state of Rhode Island. We're also home to the nation's fourth largest city, the city of Houston. I want to thank the National Academy of Sciences and the LabX program for having me. History, we know, shows that severe illness and death rates tend to be higher for racial and ethnic minority populations during a whole host of public health emergencies, not just COVID-19, but well beyond. We also know that contributing factors for these health inequities include lack of health insurance, lack of access to health care, and underlying health conditions like diabetes, high blood pressure, obesity, and other factors. In Harris County, 20 to 25% of our entire community still lacks health insurance, and this is even worse in many of our minority communities. The vulnerability of these communities, especially to COVID-19, can also arise from a whole host of other factors, including differential exposure, susceptibility, and even, again, access to healthcare. Let me give an example. For many of our Hispanic community members, they work frontline jobs in grocery stores, waste management, cleaning, sanitation services, food delivery, places where they have to be on the job. That puts them at constant exposure to people, materials that may be infected with COVID-19. In addition to work circumstances, a lot of these individuals are in living conditions that may also increase their risk for COVID-19. A quarter of Hispanic people in Harris County, for example, live in multi-generational households, which may make it challenging to take precautions to protect older family members like grandparents or to isolate those who are sick if space in the household is limited. We know that these health disparities are driven by underlying health inequities. And amongst our Hispanic and minority populations, this goes well beyond COVID-19. We want to make sure everybody recognizes the absolute importance of public health and what we do on the ground to address health inequities in our communities. At the end of the day, our job is about prevention. Our job is about making sure people do not get sick in the first place. When we do our job well, unfortunately, it's largely invisible. And what I say is that we're the offensive line of the football team, though everybody focuses on the quarterback. It is absolutely critical for us to continue to do our job and for all of you to help in this role because we are all in it together to protect our communities. Thank you for what you're doing, and thank you for being a part of the LabX project.